We don't always talk about bladder cancer, but you should know about it. And I'm going to tell you some of the symptoms of bladder cancer. Now, bladder cancer is a relatively rare form of cancer, and it starts in the lining of the bladder. By the way, did you know that your bladder holds about 2 cups of pee? That's about the size of it. Bladder cancer happens when the cells in the lining of the bladder become cancerous, when they change, when they get distorted. By the way, that's how cancer happens pretty much anywhere, is that the cells change and turn problematic. But that's where it happens with the bladder. Of course, if it's left untreated, you get into lots of problems. But for many people, bladder cancer is treatable. There are different types of bladder cancer, and there are different stages of bladder cancer. And both of those are going to determine how likely it is that a bladder cancer will be able to be treated and what the treatment is going to be. By the way, write in the comments if you know someone who's ever had bladder cancer, if you have it, etc. So let me know. Bladder cancer is the 4th most common cancer in men, believe it or not. And actually, men are more likely to get bladder cancer than women, okay? And then when women do get bladder cancer, oftentimes we have more advanced disease or more advanced stages. Bladder cancer usually happens in people who are on the older side, typically people age 55 and older. And on average, people are about 73 years old when they're diagnosed. Now, when it comes to symptoms, all right, let's break it down, okay? Probably the most common symptom of bladder cancer is blood in your pee, blood in your urine. Okay. Now, blood in your urine doesn't have to mean you have cancer, but if you have blood in your urine, you got to get checked out to make sure it's not cancer. But remember, it can be other things. But that is the most common sign of bladder cancer. But other potential signs and symptoms of bladder cancer could be things like problems urinating, meaning like maybe you have to go, you have to pee more than usual. You have to pee a lot more than what's normal for you. Or maybe when you pee, it hurts or it burns or it stings. It's really uncomfortable. Maybe you have pain in your penis if you're a guy after you urinate. Sometimes there are other urinary symptoms, but let me be honest with you. Not everybody with bladder cancer has symptoms at all. And that's why sometimes it can be tough. I mean, this is the case for many cancers, right? You don't always have to have symptoms, okay? Also, I should mention another potential symptom is when the urine flow sort of starts and stops, like it goes and stops, it goes and stops, that can be a problem as well. Now, this is a thing. If you have any of those symptoms, you need to be talking to your doctor anyway, because we should be figuring out what's going on. But as I said before, if you see blood in your urine, even if you see it just one time, and I've had patients like this, they only see it one time, so they're like, oh, it must not have been anything. Even one time, go see your doctor. Now, let me mention something about risk factors, okay? Who's more likely to get bladder cancer? I told you that men have it more commonly than women, older folks, etc. But other risk factors include those who smoke cigarettes, okay? The smoking cigarettes actually more than doubles your risk of getting bladder cancer, believe it or not. Also, smoking pipes, cigars, being exposed to secondhand smoke can increase your risk. The other thing is being exposed to radiation. Like radiation therapy to treat cancers can actually increase your risk of developing bladder cancer. Not great, but yes, it can happen and rather increase your risk. Chemotherapy, sometimes some chemotherapy drugs can increase your risk. Exposure to certain chemicals, okay, like certain dyes or rubbers or like leather, textiles, like if you work in certain plants or environments like that, that might increase your risk. And also people who have frequent bladder infections, okay, or other urinary issues, all right? There's other potential risk factors as well. Yes, there are ways to diagnose this, okay? We have the urinalysis. That's when you pee in a cup, we send it off to the lab or we dip it in the office. We can look at the cells called cytology, take a look at what those are. We can also, and what we often do is we can also get you to a urologist, which needs to happen, and you get a cystoscopy. That's what they put a little scope in your bladder and take a look. But if you do have cancer, there are many treatments. Again, it depends on what type of cancer you have and what the stage or grade is. What's most important is that if you have any symptoms that are unusual, such as the ones I mentioned or anything else, you got to see your doctor right away. Don't put that off, okay, my friends? All right, so write in the comments what's been going on with you, if you've ever had this, blah, blah, blah. Let me know if this is helpful. Please subscribe to my channel. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Also, I do daily videos. I'm on Facebook, like my page. I'm on TikTok, Instagram, LinkedIn, Threads, you name it, all the stuff. Please follow me there. Also, sign up for my free health newsletter at drjencaudle.com. Love y'all.